Let's head now to the Bono East region, which has seen a sharp increase in its National Health Insurance Authority membership renewal since the introduction of the digital mobile registration platform. Regional NHIA Director George Opong-Dankwa, in an interview with Joy News at this year's third quarter review meeting, stated that the new platform had been highly patronized in the rural areas compared to the urban centers. Correspondent Anas Sabit has more.
The mobile-based health insurance renewal system was introduced by the National Health Insurance Authority with the aim of improving coverage, particularly for members who hitherto were likely to renew their membership. The system, policymakers say, was to, amongst other things, devise innovative ways of enrolling new and existing members to accelerate progress towards the attainment of universal health coverage. Bono East Regional NHIA Director George Opong-Dankwa disclosed to Joy News that the new online system has benefited more people from the rural settings compared to those in the urban areas.
Mobile renewal has really benefited the rural communities even more than the urban communities. For the urban areas, most of them think that the health insurance office is closer to them, so they normally come to the office to renew. But for the rural communities, traveling from, for instance, my village, Kranka, to Nkranda town, the lorry fare, the inconveniences and whole lot, they will prefer using the mobile phone to renew their membership than coming to the office to renew.
Mr. George Opong-Dankwa, who was speaking on the sidelines of this year's third quarter review meeting in the Chiman, however, revealed that the authority has fallen short this year compared to same period last year. This, he says, is largely as a result of some difficulties in accessing some communities in the eastern part of the region who were cut off as a result of the recent floods in the area.
Bono East, we have peculiar issue. For instance, when you go to Senate and Pro districts, majority of our people are beyond the river, and we have tried to cross, but because of the level of the river, it's been challenging. So that's the more reason why people we are falling short at those areas. We can't cross because of the level of the river, and they also, it's very difficult for them also to come to our offices. And the rules to network to is also challenging. There are some areas that you can't use vehicles to go to. Though we have motor bicycles, but very, very difficult to go. But in all, we have resolved that whether rain or shine, we are going to achieve our targets. We will do our possible best to achieve our targets.
With the recent improvement in the payment of claims to service providers by government, Mr. George Opong-Dankwa appealed to service providers to improve its services to beneficiaries when they visit their facilities for healthcare.
We say every good thing deserves another. So once National Health Insurance, we have doing our part in terms of prompt payment of claims to our cherished facilities or health providers, we also expect them to do same to our members. When they come, the services that they need, they have to provide to them. If the service is within the health insurance benefit package, where there's no need for the person to pay any additional money, they have to give to them so that we all enjoy the full benefit of national health insurance. So once we are doing our part, we expect also them also to do their part.
Reporting for Joy News, Anas Sabit, Teacherman.